Good morning, everyone. Thank you for being here today. I'm excited to introduce our presentation on certain conditions originating in perinatal period. Today, we'll explore various conditions that begin around the time of birth and their impact on health. We'll cover key topics related to perinatal conditions, their causes, and management strategies. Let's get started. Today, I want to introduce you to the concept of the perinatal period. This is a crucial time that covers both pregnancy and the period shortly after childbirth. It generally spans from around 20 weeks of gestation, that's about halfway through pregnancy, up to 28 days after the baby is born. This time frame is incredibly important because it's when a lot of key developmental and health-related events happen. Understanding this period helps us better support both the mother and the newborn, ensuring healthier outcomes. As we move through this presentation, keep in mind that this phase sets the foundation for the child's future health and well-being. Now, let's look at the guidelines for conditions originating in the perinatal period. When coding these conditions, remember that codes from Chapter 16 should be used only if the condition actually started during the perinatal period. If the condition develops later in life, different codes are appropriate. It's important to distinguish these conditions because they are coded and reported separately from maternal conditions, and if the condition persists, these codes can be used throughout the patient's life. A key point here is the Z38 category. When documenting the place of birth and type of delivery, you must append a code from category Z38 as the principal diagnosis code. This helps clearly specify the birth details. Remember, a code from this category can only be used once at the place of delivery, so accuracy is essential. Overall, these guidelines help ensure we're capturing the perinatal conditions correctly, which is crucial for proper documentation, billing, and understanding the patient's health history from the very start of life. Now, let's look at the guidelines for coding conditions that originate during the perinatal period. When we're working with newborn conditions, it's really important to distinguish between those that happen during the birth process and those that are acquired from the community after birth. The ICD-10-CM guidelines give us clear instructions on how to handle this distinction. If a condition clearly occurs in the community, say a newborn develops pneumonia after leaving the hospital, we should not assign a code from Chapter 16, which covers P00 to P96. Instead, we need to use a code from another chapter that accurately reflects the condition as community acquired. This is a key point because it affects how we document and code these cases. For example, if a newborn develops pneumonia in the hospital during the perinatal period, that would be coded as a perinatal condition. But if the pneumonia happens after they leave, even if it developed shortly after birth, it's considered community acquired, and we code it accordingly. Understanding this distinction ensures accurate coding, which is vital for proper data collection and reimbursement. It also ties into the bigger picture of ensuring consistent, precise documentation for all neonatal conditions. When coding for certain conditions that originate in the perinatal period, it's important to pay attention to how we document birth weight and gestational age. In the ICD-10-CM, we use specific codes in the P07 category for birth weight and P05 for gestational age. This helps ensure accuracy and consistency in our records. One key point to remember is that when coding both birth weight and gestational age for a newborn, the birth weight code should always come first. This sequencing is essential because it reflects the priority in documenting the baby's physical condition at birth. For example, if you have a preterm baby with a specified gestational age and birth weight, you'd code the birth weight first using a P07 code. Follow that with the P05 code for the gestational age. Doing this correctly helps providers and coders communicate clearly about the baby's condition and ensures proper data collection. So, in summary, always remember, first code the birth weight, then the gestational age. This sequencing supports accurate documentation and aligns with coding guidelines, which is a crucial part of our overall approach to managing perinatal conditions. When it comes to coding conditions that originate in the perinatal period, we primarily use codes from Chapter 16, which are designated as P00 through P96. These codes are specifically for newborns when the condition started during that perinatal window. It's important to remember that these codes should never be applied to the mother's record. They are strictly for the newborn's documentation. Another key point is that if the condition persists throughout the patient's life, these same codes can be used long-term. So, they are not just for initial diagnosis, but can be applicable as the patient ages if the condition remains present. Now, when we're looking at the primary diagnosis on a newborn record, the general rule is that Chapter 15 codes usually take the principal or first listed position. However, there's an exception for birth encounters. In those cases, a code from category V30 should be listed as the principal diagnosis. This helps ensure proper classification and clarity in coding the birth event itself. Overall, understanding these guidelines ensures accurate and consistent coding, which is crucial for proper documentation, billing, and data collection in perinatal care. Now, let's talk about the guidelines for certain conditions originating in the perinatal period, specifically regarding observation and evaluation. First, when it comes to Z05, this category is used for newborns who are being observed or evaluated for conditions that are suspected but ultimately ruled out. So, it's important to remember that Z05 is not for confirmed conditions, but for cases where suspicion exists during observation. Next, an essential point is that we should only use a code from category Z05 if the newborn shows no signs or symptoms of the suspected condition. If there are signs or symptoms present, different coding would be necessary, so this highlights the importance of assessing the newborn thoroughly before assigning this code. Additionally, when reporting Z05 on a birth record, proper sequencing is crucial. The primary diagnosis should be a code from category Z38, which covers live-born infants. The Z05 code should then follow as a secondary diagnosis. This sequencing helps ensure clarity and accuracy in medical documentation and billing. Overall, these guidelines help us accurately document cases where newborns are observed for potential issues that are later ruled out, ensuring proper coding practices are followed.